Hannah.
Hi.
Nice to meet you.
Nice to see you.
How are you?
I'm okay.
All right. I'm Dr. Matt. I'm going to do your women's health examination today. So yeah, I see here that you're the first time in our clinic. And can you please tell me when was your last OB-GYN annual?
A year ago.
A year ago. Okay. All right. So since you're a first-time patient, I'm going to have to go through a series of questions to make sure that I know you very well. And let's go and check today's date. Can you please verify your first and last name and your date of birth?
Anna Johnson, March 10, 1992.
Okay. Okay. Who's your primary care provider?
Madeline Drummond.
Okay. Do you have any drug allergies?
No.
Any sensitivities?
No.
Okay. All right, so you're here for your annual exam. Do you have any issues?
I do have a little bit of dryness and pain sometimes, but it's not that severe.
Okay. And have you noticed that the dryness and pain are in a certain time of your period or in the month?
Yeah, usually it's in the middle of my period. It's like in the middle of the month.
Okay. Okay. When was your last menstrual period? The date?
Oh, June 28th.
Okay. And would you say that your periods are regular, irregular, or no periods?
Regular.
Regular. Okay. Any changes?
No.
Okay. Are you taking hormone therapy?
No.
Are you sexually active?
Yes.
Okay. Do you use any method of contraception?
Yes.
Okay. Which one?
I do the birth control.
Okay. Okay. And for how long have you been on the birth control?
Like for 3 months.
Okay. Do you drink alcohol?
No.
Okay. When was your last pap test?
A year ago.
So we're not going to do one this year. Okay. Do you remember the results from a year ago?
They were good.
They were good? Okay. All right. Have you ever had a colonoscopy?
No.
All right. A mammogram?
No.
Okay. All right. Have you ever had a bone density screening test?
No.
Okay. Do you exercise?
Yes.
All right. How many minutes and per week would you say?
I would say like 3 times per week, an hour a day.
Okay. So 180. Okay. All right. Any hospitalizations or surgeries?
No.
Okay. Any illnesses in your family?
No.
All right. Have you experienced any significant weight loss?
No.
All right. Any constipation?
Yes.
All right. For how long have you had that?
I had that for the past like 6 months.
Okay. Any urgency when you go to the bathroom?
No.
Okay. All right. Any breast pain?
No.
All right. Any moles?
No.
Okay. No abnormal bleeding either?
No.
Okay. How would you describe your periods? Are they painful, not painful?
I would say more painful.
Okay. Are you experiencing any pelvic or abdominal pain?
And both during my periods.
Okay. And during that time, would you say, how would you rate your pain from a 0 to 10, 10 being
I would
excruciating
say
pain?
4, 5.
Okay. Any anxiety or depression?
Maybe a little bit of anxiety.
Okay. And would you say that it's interfering with your daily activities?
It does sometimes.
Okay. Are you taking any measures to control that? Is it working?
Yes, I would say. I mean, like working out helps me a lot, and I'm taking like natural precautions as a CBD oil.
Okay. Yeah, CBT is very good. If you need anything from me, go ahead and let me know, okay? I'll be
Okay.
more than happy to help you out with that. Have you noticed any hair loss?
No.
Okay. Any hot flashes?
No.
All right. So it looks like we're going to go ahead and begin the exam. Okay. So I'll take your temperature. All right. Just gonna go on your index finger. Okay. And since it's the first time at our clinic, I would like to take a baseline of your blood pressure. We do that with our patients. And then we do it once a year as well. Okay. Okay, blood pressure looks very good. 125/60. Okay. Oxygenation 98% under a mirror. Heart rate is 80. Excellent. All right, I'm going to go ahead and listen to your heart and your lungs. Can you take a deep breath in and exhale? Okay. And again, take a deep breath in and breathe out. All right. Go ahead and breathe normal. I'm just going to listen to your heart. Okay. Regular heart rhythm. All right, I'm going to have you change in this gown and we're going to do the exam. Okay, and I'm just going to go ahead and put gloves on. Do you do self-breast examinations?
Yes.
Okay. How often?
Maybe once a month.
Once a month is perfect. Okay. Alright, so I'm going to go ahead and first examine your lymph nodes and mammary glands in the armpit. Okay, so we're going to start with the right one. I'm just going to palpate. I'm looking for any swelling. Okay, and on the left side. Not feeling any swelling. No lymph node enlargement. Okay. So I'm going to go ahead and open the gown, take a look at the breast. So first we're going to compare, look for symmetry. Okay, it seems like your left is a little bit larger than the right, which is normal. I'm not seeing any redness. All right, so I'm gonna go ahead and use a circular motion to palpate. Let me know if you feel any kind of pain. So we're looking for any cysts.
No, I don't feel anything.
Okay. That's definitely a good sign that you do not have any pain. Do you drink a lot of coffee?
Yes, I do.
Okay. Sometimes caffeine can contribute to the pain during the menstrual period. So reducing that in chocolate could diminish the tenderness. Okay. Not feeling anything. Looks very normal. Okay. At 12 o'clock, I'm feeling a small cyst. Seems to be fluid. Sometimes those could be caused by hormonal imbalances, and they go away with the menstrual cycle. Okay, so I'm gonna have you lay down and I'll do an abdominal exam, so pelvic and also a vaginal examination, okay?
Okay.
All right, Anna, are you comfortable?
Yes.
Okay, so I'm gonna go ahead and open the gown. So we're gonna take a look at the pelvis and the pelvic area. Okay. I'm going to do a gentle palpation, okay? Let me know if you feel any kind of pain. So we're looking for any enlargement of the ovaries or uterus, since you did say that you're having some issues. Okay. Here is the left ovary. Okay, I'm going to palpate uterus. A little bit hard and tensed. be enlarged. We would definitely know for sure with an ultrasound. Okay. Checking left ovary. No, sorry, right ovary. Okay. One small scratch here. No, not scratch. Looks like a cut.
Yeah.
Okay. Did you have any procedures done or just
yes.
an accident?
Just an accident.
Okay. Okay. Okay, here is the right ovary. Any pain when I'm pressing down?
A little bit.
Okay.
Yeah, and here too. Not as much. No. No.
Okay, so increased tenderness on the left side. The left ovary does seem to be a little bit enlarged. Okay, so let's go ahead and do a vaginal exam as well. Okay, Anna, so I'm gonna go ahead and explain everything that I'm doing before I'm doing it so that you're prepared and you know what's going to happen. I'm going to lift the gown a little bit up so I can take a look. Okay. And just going to get the tones. Perfect. So taking a look, I'm not seeing any lumps. Right. Bartholin cyst are non-swollen visually. I'm not seeing any secretions. I'm gonna go ahead and palpate on the outside area. Let me know if you feel any kind of pain. So you're gonna feel my fingers here, okay? Okay. I'm not feeling any cysts. Okay. Alright, so since you did complain of some dryness, I'm gonna go ahead and take a sample, right? And we're going to send it to the lab. Okay. Alright, so that's one. We said we're not going to do PAP, but we are going to do just a few tests to see if we find anything that we can treat. Okay. Alright, so now I'm going to go ahead and use a speculum. It's going to feel a little bit cold. That usually helps to enlarge the canal and be able to visualize the cervix. We're going to take a look and see if there's any bleeding, okay? Alright, so you're going to feel a little bit of coldness here. Okay. And there's a little bit of redness. I'm just going to go ahead and take a sample of that. Okay. So you're going to feel one more pinch, all right? Okay, perfect. So let's go ahead and take that. And I'm going to send this to the lab. Okay. All right. Well, we finalized the test. I'm gonna have you sit up and we're going to discuss the results, okay? Okay, and I'm just going to take my gloves off. Everything looks good. So we did take a few samples and we're going to send those to the lab. I'm going to have your results, I would say, in about 48 hours to 72, so 2 to 3 days. If you don't hear from me, that's a good sign, okay? If anything comes back suspicious, then I will definitely give you a call as soon as possible.
Okay, thank you.
All right? I'm going to go ahead and prescribe some vitamins. And I'll have you take those once a day, all right, in the morning. Also, I'm gonna have you go do some other tests, okay? So we'll do a blood work and we'll test your estrogen, your prolactin, and other hormones to see if there is any imbalance there. All right, we're gonna do an ultrasound of the ovaries, since on the left side I did notice a little bit of enlargement. Some people are born anatomically like that, so that could be normal. But if there is something else, we will definitely have the results with the ultrasound. So we'll do that. I'll have you schedule it whenever you have a chance, and the order is going to be in the computer, so they'll be able to see it. Okay. And after that, we're just gonna go day by day and see the results from the tests. All right.
Sounds good.
Do you have any questions for me?
No, not really.
All right. It was very nice to meet you.
Nice to meet you.
Thank you for coming.
Thank you.